I'm Ajay Nooka. I'm the director of the myeloma program at Emory. We have presented the results of the maintenance therapy with carfilzomib, pomalidomide, and dexamethasone in high-risk myeloma patients. So this is a phase 2 study with a safety run-in. Not all patients are the same. There is approximately around 25% of the patients who do not play by the rules. Their disease is very aggressive. The disease is not controlled for much longer, even if they go for a stem cell transplant. The intent of this trial is to measure the complete response rates among these high-risk patients who were defined as either patients presenting with primary plasma cell leukemia, which means they have plasma cells circulating in the blood, or presence of high-risk cytogenetics called deletion 17p, translocation 414, translocation 1416. What we've done was we took these patients who have completed it, who have these abnormalities, received the induction treatment, completed a transplant, and before 3 months after the transplant, we started giving them a combination maintenance treatment, which includes the 3 drugs that we talked about: carfilzomib, pomalidomide, dexamethasone. Why do we want to do this? We want to get the deepest response, and we also wanted to see if we can maintain that response and not let the patients relapse. So the primary endpoint for this trial, as we call, is the complete response. And the secondary endpoints are overall survival, the progression-free survival, and whether the patients are able to get an MRD negativity. So we took a total of 32 patients. 3 patients were not able to receive the pomalidomide because of insurance reasons. So 29 patients were evaluable. So among these 29 patients, 17, which is 60% of the patients, are Black. And 60% of the patients had more than one high-risk abnormality. And when you look at the baseline, at the time when the patients went on to the study entry, the complete response rates were a mere 24%. 2 months later, the best response rate was 90% among all the patients that were evaluable. If you look at the MRD negativity rates, MRD negativity at 10 to the power of minus 5, that is ability to find one myeloma cell in 10,000 myeloma cells, the 10,000 bone marrow cells, happened in 90% of the patients. In 90% of the patients, they were not able to find even one myeloma cell in 1,000 bone marrow cells. How about we look at 1 million cells? 66.6% of the patients, you were not able to find one myeloma cell when you checked in 1 million bone marrow cells. So how did this translate to continue to keep the disease down for the longest period of time? So we followed for a total of 40 months. So that's what we call as a median follow-up. At a median follow-up of 40 months, majority of the patients still remained in remission. So the estimated 4-year progression-free survival, that means 54% of the patients did not progress at the 4-year mark. And if you look at the patients who achieved a MRD negativity at 10 to the power of minus 6, just like how we talked about what it means, the patients where we did not find even single myeloma cell in 1 million bone marrow cells, the PFS did not reach at 40 months. So patients, on the contrary, who were MRD positive, their median PFS was 44.3 months. So if you look at the overall survival, at the 4-year overall survival was 67%. This is a very high-risk group. Even though this is a high-risk group, around 2/3 of these patients were alive at the 4-year mark. So who did not do well? Those patients that have more than 2 high-risk abnormalities, just like how we talked about, those 60% of patients who have more than 1 high-risk abnormality, their median PFS is 30.7 months. So from a safety perspective, these drugs are very well tolerated. And the most common side effects are the hematological side effects, which means blood-related side effects. Neutropenia was seen in half the patients, anemia in 15%, and thrombocytopenia, that's low platelets, seen in 10% of the patients. So carfilzomib can cause cardiac problems. How often did we see these cardiac problems? A higher grade 3 or 4 events were seen in 6.8%. All cardiac events accounted for approximately 15% of the patients. So which is similar to what we see in the literature. So majority of the patients still continue to be on the trial. So there are patients who completed the trial, and 10 of these 29 patients had progressive disease. And majority of the patients who had progressive disease, 5 of these 10 people died. So the take-home message is, if we want the patients to live longer with this high-risk disease, we should not let them relapse. So now, if you look at the current existing literature, it all supports using the combination maintenance. But probably this is the group of patients that certainly should receive the combination treatment, so that the ultimate goal of living longer is only achieved by preventing that relapse. And that should be the key or the goal, where this current combination was able to achieve that. So that's what our research shows. And this is what our standard of care at Emory has been, giving combination maintenance treatment for the high-risk patients.